No matter where you are with type 2 diabetes, there are some things you should know. It's the most common form of diabetes. Type 2 means that your body doesn't use insulin properly, and while some people can control their blood sugar levels with healthy eating and exercise, others may need medication or insulin to manage it. Regardless, you have everything you need to fight it. Hello reviewers, welcome back to our channel. Today we have brought to you the facts you should need to know about type 2 diabetes. So watch the video until the end to never miss a thing. If you are new to the channel and if you like what you see, please consider subscribing to our channel and smash the notification bell so that you'll be the first one to be notified when we upload new videos. If you are already a subscribed member, please like and share this video so that it could reach a wide range of audience. Type 2 diabetes is an impairment in the way the body regulates and uses sugar or glucose as a fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into your cells, and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult-onset diseases, but both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise aren't enough to manage your blood sugar, you may also need diabetes medications or insulin therapy. When you look at the symptoms of type 2 diabetes, signs and symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include the following: increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, a slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin usually in the armpits and neck. Make sure to see your doctor if you notice any signs or symptoms of type 2 diabetes. Causes. Type 2 diabetes is primarily the result of two interrelated problems. Cells in muscles, fat, and the liver become resistant to insulin. Because these cells don't interact in a normal way with insulin, they don't take in enough sugar. The second case is the pancreas is unable to produce enough insulin to manage blood sugar levels. Exactly why this happens is unknown, but being overweight and inactive are key contributing factors. Insulin is a hormone that comes from the gland situated behind and below the stomach or the pancreas. Insulin regulates how the body uses sugar in the following ways. Sugar in the bloodstream triggers the pancreas to secrete insulin. Insulin circulates in the bloodstream, enabling sugar to enter your cells. The amount of sugar in your bloodstream drops. In response to this drop, the pancreas releases less insulin. Glucose, a sugar, is the main source of energy for the cells that make up muscles and other tissues. The use and regulation of glucose includes the following. Glucose comes from two major sources, food and your liver. Glucose is absorbed into the bloodstream where it enters cells with the help of insulin. Your liver stores and makes glucose. When your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. In type 2 diabetes, this process doesn't work well. Instead of moving into your cells, Sugar builds up in your bloodstream. As blood sugar levels increase, the insulin-producing beta cells in the pancreas release more insulin. Eventually, these cells become impaired and can't make enough insulin to meet the body's demands. In less common type 1 diabetes, the immune system mistakenly destroys the beta cells, leaving the body with little to no insulin. Risk factors. Factors that may increase your risk of type 2 diabetes include the following. Weight. Being overweight or obese is a main risk. Fat distribution. Storing fat mainly in your abdomen rather than your hips and thighs indicates a greater risk. Your risk of type 2 diabetes rises if you are a man with a waist circumference of about 40 inches or 101.6 centimeters, or a woman with a measurement of above 35 inches or 88.9 centimeters. Inactivity. The less active you are, the greater your risk. Physical activity helps control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Family history. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes. Race and ethnicity. Although it's unclear why people of certain races and ethnicities, including Black, Hispanic, Native American, and Asian people and Pacific Islanders, are more likely to develop type 2 diabetes than white people are. Blood lipid levels. An increased risk is associated with low levels of high-density lipoprotein or HDL cholesterol, the good cholesterol, and high levels of triglycerides. Age. The risk of type 2 diabetes increases as you get older, especially after age 45. Prediabetes. Prediabetes is a condition in which your blood sugar level is higher than normal but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Complications. Type 2 diabetes affects many major organs including your heart, blood vessels, nerves, eyes, and kidneys. Also, factors that increase the risk of diabetes are risk factors for other serious chronic diseases. Managing diabetes and controlling your body's sugar can lower your risk for these complications or coexisting conditions. Potential complications of diabetes include heart and blood vessel disease, nerve damage or neuropathy in limbs, other nerve damages, kidney diseases, eye damage, skin conditions, slow healing, hearing impairment, sleep apnea, and dementia. Prevention. Healthy lifestyle choices can help prevent type 2 diabetes, and that's true even if you have biologically relatives living with diabetes. If you have received a diagnosis of prediabetes, lifestyle changes may slow or stop the progression to diabetes. A healthy lifestyle includes eating healthy foods, getting active, losing weight, avoiding inactivity for longer periods. For people with prediabetes, metformin, an oral diabetes medication, may be prescribed to reduce the risk of type 2 diabetes. This is usually prescribed for older adults who are obese and unable to lower blood sugar levels with lifestyle change. Well, dear viewers, that's all we have for you today. What's your experience with type 2 diabetes? Give us your opinion in the comment section. By now you know that our channel is full of inspiring videos which you can apply in your life from time to time. If you like our content, please consider subscribing to our channel if you haven't already, and also smash the notification bell so that you'll be the first one to be notified when we upload new videos. Thank you for watching until the end. We look forward to seeing you in our next video. Until then, stay safe and stay blessed.